That person? That's your pharmacist. Not just a pill dispenser. Not just the one who gives you a knowing nod when you grab your allergy meds. We are frontline health professionals trained extensively to manage chronic diseases, optimize medications, and keep your health on track in ways that are often overlooked. And as a pharmacy student, let me tell you, managing chronic disease is not a side topic for us. It's the main event. Let's start by breaking down a common misconception that your pharmacist's job is simply to count pills and print labels. Nope. That's like saying a pilot's job is to wear a hat and talk over the intercom. Sure, it's part of the job, but the real work happens behind the scenes, and it goes deep. Pharmacists are highly trained medication experts. We go through years of schooling, learning not just what medications do, but how, why, when, and for whom. And nowhere is that more important than in the world of chronic disease. Think about the big hitters in healthcare. Diabetes, high blood pressure, high cholesterol, asthma, COPD, heart failure, arthritis. These are conditions that don't get cured with one prescription. They require careful, long-term management, the kind of management that involves multiple medications, lifestyle changes, routine monitoring, and ongoing adjustments. That's where we come in. Pharmacists are uniquely positioned to help patients manage chronic diseases because we're often the most accessible healthcare professionals in the system. You don't need an appointment to see us. You can walk into your local pharmacy, ask a question, and walk out with an answer, or even better, with a plan. In fact, when I was working in retail pharmacy as a technician, I saw this play out constantly. People would come in, not for their prescription, but to talk to the pharmacist. They'd lean over the counter and ask about a weird symptom, or whether they should switch to the generic, or what to do if they missed a dose. And the pharmacists loved answering those questions. They'd light up, because it wasn't just about pills, it was about people. And now, as I go through pharmacy school, I see why. We're trained extensively on chronic conditions, how they're diagnosed, how they progress, which medications work best and why, what side effects to watch out for, how to interpret lab results, and how to spot when something's not working the way it should. So when someone with diabetes walks in and says, "Hey, I've been feeling really tired lately," a pharmacist doesn't just nod politely. We think about their A1C levels. We consider whether their metformin dose is working. We wonder if it's time to add or switch to another agent, maybe an SGLT2 inhibitor or a GLP-1. We think about drug interactions, kidney function, dietary factors, and even their access to care. That's how deep it goes. And the data backs this up. Studies have consistently shown that when pharmacists are involved in chronic disease management, outcomes improve. Blood pressure control improves. Blood sugar control improves. Medication adherence improves. Even hospital readmission rates go down. One study found that pharmacist-managed hypertension care achieved target blood pressure control in patients more effectively than usual physician-led care alone. Why? Because pharmacists have the time, the training, and the medication expertise to fine-tune a treatment plan on the spot. Let's talk polypharmacy for a second. That's when patients, especially older adults, are on multiple medications, often prescribed by different doctors. Sometimes the drugs interact. Sometimes they duplicate each other. Sometimes they cause new symptoms that get mistaken for a new illness and treated with another drug. This can quickly spiral. Pharmacists are the last line of defense in these cases. We catch those interactions, those duplications, those risky combinations. We notice when someone has 3 meds that all lower blood pressure and no one's monitoring for dizziness. We flag when someone's been prescribed a medication that's contraindicated with their kidney function. We don't just dispense, we safeguard. And let's not forget about medication adherence. That's a fancy term for actually taking your meds as prescribed. It turns out nearly 50% of people with chronic conditions don't take their medications consistently. Sometimes they forget. Sometimes they can't afford them. Sometimes they stop because they don't feel any different. And that's especially common with conditions like hypertension or high cholesterol, where the symptoms are invisible until something goes wrong. Pharmacists play a critical role here. We're the ones who notice when refills aren't coming in. We're the ones who call and ask, "Hey, how are things going with your meds?" We're the ones who explain why a statin matters even if you don't feel high cholesterol. And we're trained to help people work through barriers, cost, confusion, side effects, to stay on track. Chronic disease management is also about education. Patients often walk out of the doctor's office with a new diagnosis and a prescription, but not a lot of context. What does this med do? How long do I need it? What foods should I avoid? What side effects should I worry about? And which ones are normal? This is our wheelhouse. Pharmacists fill in those gaps. We break it down in plain language. We make it less scary. And when patients understand their treatment plan, they're far more likely to stick with it. But here's something even more exciting. Pharmacists aren't just doing this informally anymore. Across the country, there's a growing trend of collaborative practice agreements, partnerships between pharmacists and physicians that allow pharmacists to adjust medications, order labs, and manage chronic conditions directly. That means more proactive care, fewer delays, and better outcomes. We're also seeing the rise of clinical pharmacists in primary care settings, hospital discharge teams, specialty clinics, and telehealth, all helping manage chronic disease from every angle. Pharmacists are running anticoagulation clinics, diabetes education programs, hypertension management services, and more. And the future? It's only getting brighter. As a pharmacy student, I can tell you the focus on chronic disease is only increasing. We're trained to think holistically, not just about meds, but about lifestyle, nutrition, behavioral health, social determinants of health, and more. We're part of a bigger puzzle, not in the background, but right up there with your doctor, your nurse, your dietitian. So next time you have a question about your chronic condition, or your dad's blood pressure, or your grandma's diabetes, or even your own meds, don't underestimate the person behind the counter in the white coat. We're not just pill counters. We're medication experts, chronic disease coaches, and one of the most underutilized healthcare resources out there. And we're here every day in your neighborhood, ready to help you live a healthier, longer, more informed life. Thanks for watching. If this helped you see your local pharmacist in a new light, hit that like button and subscribe for more pharmacist-informed, myth-busting health content every Friday at 5 p.m. MST. Got a question about your meds or want to share your own experience with chronic disease management? Drop it in the comments. I read every one, and your story could help someone else feel seen and supported. Until next time, take care of your health, and don't forget, your pharmacist is just a question away.